Welcome to today's video lecture on madeformedical.com. Today, we're going to delve into a fascinating topic, amyloidosis. Before we start, don't forget to check out our website, madeformedical.com, for hundreds of more videos like this at the end of this video. Link is in the description. In this session, we will delve into the key aspects of this condition, including its etiology, clinical presentation, diagnostic approaches, and treatment options. By the end of this lecture, you will have a solid understanding of Paget's disease of bone and its management strategies. So, let's begin. Paget's disease of bone, also known as osteitis deformans, is a chronic bone disorder characterized by abnormal bone remodeling. It involves excessive bone resorption followed by disorganized and excessive bone formation. This leads to the affected bones becoming enlarged, weak, and structurally abnormal. The exact cause of Paget's disease is still not fully understood, but it is believed to involve a combination of genetic and environmental factors. It typically affects individuals over the age of 50, with a higher prevalence in certain geographical regions, such as Europe and Australia. In Paget's disease, the bone remodeling process is disrupted. Normally, bone tissue is constantly being broken down by specialized cells called osteoclasts and rebuilt by cells called osteoblasts. However, in Paget's disease, there is an increased number and activity of osteoclasts, leading to excessive bone resorption. This is followed by a compensatory increase in osteoblast activity, resulting in the formation of new bone that is structurally abnormal and weaker than normal bone. The pathophysiology of Paget's disease of bone involves an imbalance between bone resorption and bone formation, leading to abnormal bone remodeling. It is a complex process influenced by various cellular and molecular factors. Here is an overview of the key pathophysiological mechanisms involved. Increased osteoclast activity. In Paget's disease, there is an increased number and activity of osteoclasts, the cells responsible for bone resorption. It is believed to be triggered by genetic factors and environmental triggers, although the exact mechanisms are not fully understood. Increased osteoclast activity leads to excessive bone resorption and breakdown. Disordered bone remodeling. The increased osteoclast activity causes accelerated bone resorption, resulting in the breakdown of the normal bone architecture. However, the bone-forming cells called osteoblasts attempt to compensate for the increased resorption by laying down new bone. The newly formed bone, however, is structurally disorganized and weaker than normal bone. Abnormal osteoblast function. In Paget's disease, the abnormal osteoblasts produce bone that is larger, less compact, and structurally abnormal. This abnormal bone formation contributes to the characteristic bone deformities seen in Paget's disease. The disorganized bone structure can weaken the affected bones, making them more prone to fractures. Excessive vascularization. There is evidence to suggest that Paget's disease involves increased vascularity within the affected bones. The increased blood flow may contribute to the abnormal bone remodeling process and the characteristic bone deformities seen in the disease. Genetic and environmental factors. There is a strong genetic component to Paget's disease, with several gene mutations associated with its development. Mutations in genes such as SQSDM1 and TNFRSF11O rank gene have been identified in some cases. However, not all individuals with these mutations develop the disease, indicating that environmental factors also play a role in the development and progression of Paget's disease. The clinical presentation of Paget's disease of bone can vary widely among individuals and depends on the extent and location of bone involvement. Some individuals may remain asymptomatic and are diagnosed incidentally during routine imaging studies. However, when symptoms do occur, they could be categorized into 3 stages: the lytic stage, mixed lytic sclerotic stage, and the sclerotic stage. Lytic stage. During this stage, bone resorption predominates over bone formation. The symptoms may include bone pain, the most common symptom, usually localized to the affected bone. It is often described as a deep aching or throbbing pain that worsens with activity or weight bearing. Bone deformities. In areas of active bone resorption, bone may become weakened and prone to deformities. This can lead to bowing of long bones or enlargement and deformity of the skull, resulting in changes in head shape or increased hat size. Fractures. Weakened bones are more susceptible to fractures, and individuals with Paget's disease may experience fractures that occur with minimal trauma. Mixed lytic sclerotic stage. During this stage, there is a combination of bone resorption and increased bone formation. Symptoms may include bone pain, persistent or intermittent pain, similar to the lytic stage, but often with less intensity. Increased warmth and vascularity. The affected bones may feel warm to touch due to increased blood flow in the area. Neurological symptoms. If the disease affects the skull or spine, compression of nerves or blood vessels may lead to symptoms such as headaches, hearing loss, vision changes, or nerve dysfunction. Sclerotic stage. In this stage, excessive bone formation leads to thickening and sclerosis of affected bones. Symptoms may include bone pain. The pain may be less prominent during this stage, but can still occur. Reduced range of motion. Thickened bones can restrict joint mobility and lead to stiffness. Osteoarthritis. Over time, the abnormal bone structure and joint changes can result in the development of secondary osteoarthritis. It's important to note that not all individuals progress through all stages, and the symptoms can vary significantly. Additionally, some individuals may remain asymptomatic throughout the course of the disease. If Paget's disease affects specific areas such as the spine, pelvis, or long bones, complications can arise, including spinal stenosis, nerve compression syndromes, osteoarthritis, and increased risk of fractures. Diagnosing Paget's disease of bone involves a combination of clinical evaluation, imaging studies, and laboratory tests. The diagnostic process typically includes the following steps: clinical medical history and physical examination. The healthcare provider will begin by taking a detailed medical history, including any symptoms experienced and any family history of Paget's disease or related bone disorders. They will also perform a physical examination to assess for any bone deformities, areas of tenderness, or other signs suggestive of Paget's disease. Laboratory investigations. Laboratory tests can help support the diagnosis and provide additional information. The following tests are commonly performed: blood alkaline phosphatase, a LP level. Paget's disease often results in elevated levels of ALP, an enzyme produced by osteoblasts during bone remodeling. ALP levels are typically increased in active disease. Serum calcium and phosphorus levels. These tests help assess the overall mineral metabolism and rule out other conditions that may affect bone health. Biopsy. In certain cases, a bone biopsy may be performed to confirm the diagnosis. A small sample of bone tissue is obtained, typically through a minimally invasive procedure, and examined under a microscope. Biopsy is particularly useful if other bone conditions need to be ruled out or if the diagnosis is uncertain. Imaging studies. Imaging studies play a crucial role in the diagnosis of Paget's disease. The following imaging modalities are commonly used. X-rays. X-rays can reveal characteristic changes in bone structure, such as bone enlargement, cortical thickening, and areas of increased bone density or sclerosis. X-rays are particularly useful for detecting involvement of the skull, spine, pelvis, and long bones. Bone scans. Bone scans involve the injection of a small amount of radioactive material, which is taken up by the bones. Areas of increased bone activity, known as hot spots, can indicate active Paget's disease. CT scan or MRI. These imaging techniques may be used to provide more detailed images of affected bones or to evaluate specific areas of concern, such as the skull or spine. Biopsy and histopathological analysis. A definitive diagnosis of amyloidosis often requires a biopsy of an affected organ. The choice of the biopsy site depends on the suspected organ involvement. Laboratory tests. The following tests are commonly performed: blood alkaline phosphatase, ALP level, serum calcium and phosphorus levels. The management of Paget's disease of bone involves a comprehensive approach aimed at reducing symptoms, preventing complications, and improving the overall quality of life for patients. The management strategies include pharmacological therapy. The primary goal of pharmacological therapy is to regulate bone remodeling and reduce symptoms. Medications commonly used in the management of Paget's disease include bisphosphonates. These drugs, such as alendronate, ristronate, and zoldronic acid, inhibit bone resorption and help regulate abnormal bone remodeling. Calcitonin. Calcitonin can reduce bone resorption and alleviate pain in some patients. Pain medications. Non-steroidal anti-inflammatory drugs, NSAIDs, acetaminophen, or opioids may be prescribed to manage pain. Vitamin D and calcium supplements. Ensure adequate intake of vitamin D and calcium to support bone health. Physical therapy and assistive devices. Physical therapy can help improve mobility, relieve pain, and maintain muscle strength. Assistive devices, such as canes or walkers, may be recommended to support stability and prevent falls. Monitoring and follow-up. Regular monitoring of symptoms, bone markers, and imaging studies is essential to assess treatment response and detect any potential complications. Follow-up visits should be scheduled according to the patient's individual needs. Surgical interventions. Surgery is typically reserved for patients with severe symptoms, complications, or specific situations where surgical intervention is necessary. Surgical options may include joint replacement surgery, correction of bone deformities, or surgical stabilization of fractures. Lifestyle modifications. Encourage patients to adopt a healthy lifestyle that includes regular exercise, a balanced diet rich in calcium and vitamin D, smoking cessation, and moderation of alcohol consumption. These lifestyle modifications can contribute to overall bone health and may help prevent complications. In conclusion, Paget's disease of bone is a complex condition that requires a comprehensive approach to diagnosis and management. By understanding its pathophysiology, clinical features, and available treatment options, we can provide optimal care to our patients. Remember, early diagnosis and timely interventions can significantly improve outcomes. Thank you for joining us today, and we hope this lecture has enhanced your knowledge of Paget's disease of bone. And that brings us to the end of our today's video. I hope you found the information helpful and informative. If you enjoyed this video, don't forget to give it a thumbs up, and don't forget to sign up for a premium membership on our website, madeformedical.com, for more content like this.